Hello, good afternoon. My name is Mika Ruiz. I'm a nurse practitioner. I am involved in the genitourinary med-oncology clinic, and I'm happy to be giving this talk on multidisciplinary care management of prostate cancer, enhancing care and outcomes. So why do we have multidisciplinary care at Stanford? We know that multidisciplinary care is essential for prostate cancer management for several key reasons. We know that it offers comprehensive care, which helps to ensure that all aspects of patients' care are considered. We know that prostate cancer is a complex disease with varying stages and treatment options. Multidisciplinary teams help to ensure that all aspects of a patient's care are considered. This comprehensive approach leads to a more thorough evaluation, an accurate diagnosis, and a tailored treatment plan that's offered in an unbiased manner. Next is personalized treatment. We know that prostate cancer is not a one-size-fits-all condition, which you've learned today through this seminar. Patients may require different treatments based on factors like cancer stage, age, overall health, response to prior therapies, and personal preferences. Our teams assess these factors to offer a tailored treatment strategy that helps to maximize success while minimizing treatment side effects. Next, we know that it provides optimized care outcomes. We know that prostate care treatment can have a significant impact on the quality of life. And so our multidisciplinary team collaborates to balance optimized cancer control with fewer treatment-related complications. And we know that through research, multidisciplinary care management has shown that it can improve long-term care outcomes, ensuring that patients are not only surviving longer, but are also thriving. So what are the benefits of multidisciplinary care at Stanford? We know that it offers timely care, there's improved coordination, there's continuous monitoring, there's an emphasis on quality of life, and also access to clinical trials. We know that multidisciplinary care prioritizes efficiency through timely treatment, and it allows for seamless coordination among specialists, and it provides ongoing patient monitoring to your evolving needs. And it has an emphasis on improving quality of life and facilitating access to pioneering clinical trials that may not be available elsewhere. All of these aspects are all aimed at enhancing patient outcomes and well-being. So who's involved in our multidisciplinary team? Well, first we have our core medical team, which are our medical providers. These core doctors consist of our urological surgeons, our radiation oncologists, our medical oncologists, who you've heard speak at length today on how they treat and manage prostate cancer. Again, our urological surgeons provide treatment options, such as radical prostatectomy, but they also provide management in focal therapy and also in active surveillance. Next, we have our radiation oncologists who excel in delivering radiation therapy to help eradicate disease. These modalities can include external beam radiation, brachytherapy, stereotactic body therapy, and palliative radiation to precisely target to minimize the disease. Next, we have our med oncologists who specialize in diagnosing and treating your prostate cancer, and they manage systemic therapies like oral pills, IV chemotherapy, immunotherapy, and hormonal therapy. So these core specialists, they review your health history, your imaging, your pathology, prior therapies to determine your personalized treatment plan. And these teams that I've mentioned earlier, they all collaborate, each bringing their unique experience and expertise to the table. So next is our advanced practice providers, such as myself. This includes our nurse practitioners and our physician assistants. And I have to say that I am proud to be a member, an advanced practice provider at Stanford, where we are well supported to practice at the top of our license And we are able to see patients independently or in shared visits with your oncologist. We specialize in managing and treating your prostate cancer. And so we play a vital role in the management of your cancer. We're involved in clinical assessment and evaluation of disease. We perform comprehensive assessments, including medical histories and physical examinations. We order appropriate imaging, labs, and help to interpret diagnostic tests while we collaborate with our physicians in managing your disease. We're also involved in treatment planning, where we help to develop personalized treatment plans. We then would provide education and teaching on the potential side effects. We're also involved in follow-up and surveillance. We monitor the risk for recurrence or complications when you start a new medication or undergoing treatments, and we help to ensure that these treatments continuously align with your goals and care needs. We're highly involved in symptom management, and so we manage cancer-related symptoms and treatment side effects such as pain, nausea, and fatigue. And so we may prescribe medications, provide counseling, and recommend supportive care strategies to improve your quality of life. And we're also involved in clinical trials, which all of the medical doctors have talked about. And we help to explain trial protocols, we help to monitor patients' progress, and we collect data to contribute to the advancements of prostate cancer. I would like to share that I am a co-principal investigator in running a clinical trial for Black men with prostate cancer, which was sparked by my own personal interest to better understand how access to a cardiac rehabilitation program and access to mental health may improve prostate cancer outcomes. Overall, us APPs serve as a valuable member contributing to your comprehensive care. Next, we have our clinical nurse coordinators. They guide you from your first contact to your follow-up care at Stanford. They are our first responders. They triage and address symptomatic calls and My Health messages in a timely manner. They can assess for treatment side effects, and they can coordinate the authorizations of medications, imaging, referrals, et cetera, which we know that sometimes can be challenging. And they can help to schedule expedited appointments needed across the multidisciplinary team. So our nurses are vital for the management of prostate cancer. And this list here is not comprehensive to all their hard work and invaluable support that they offer. Next I have here is a focus on the tertiary members that I have illustrated on this diagram. And I have the patient, you, at the center. And our tertiary members include social workers, palliative care, psychologists, and nutritionists, and many others that help round out this multidisciplinary care approach. They address the holistic needs of our patients, and they can offer guidance on managing treatment-related side effects and an improved quality of life. I'd like to focus on a couple of them. We have our social workers that help to provide psychosocial and emotional support. We have our palliative care clinic, which helps to manage treatment side effects, pain, and they also help to foster goals of care discussions early on. And then we have our genetics counseling, where the geneticists assess for any inheritable mutations that can help to inform you and your family members. And it could also uncover actionable mutations that we could use for other next-line therapy. Something actionable would be like the BRCA mutation, which you've heard probably through this talk. And also we have nutrition counseling. A lot of my patients are always interested in learning ways how they can optimize their diet on and off therapy, and learning ways of how they can minimize the risk of it coming back through diet. And another key group that I like here is our cancer supportive services. They provide support groups for patients and family. They offer meditation, exercise, and nutrition classes. Next is this slide here, and I have to admit this is a very busy slide, but I really like this slide because it showcases what the treatment landscape may look like for a prostate cancer patient across various stages. We know that when the disease is detected earlier, and when it's localized, meaning when it's confined to the prostate, we know that it's very treatable, whether it's with radiation therapy or whether it's with a prostatectomy. And this comes with a high potential for cure. But unfortunately, there's always the risk that it may come back. So I wanted to show this diagram to highlight the many available treatment options that are available in managing this disease, which we would then treat it like a chronic disease, which is similar to like how hypertension and diabetes would be managed. Each treatment intervention that's highlighted here, such as the oral pills you've heard called like abiraterone or apalutamide, or chemotherapy, also known as docetaxel, they all come with unique care and management, which requires monitoring, extensive follow-ups, and continued collaboration amongst our genitourinary medical specialists. Now, on this slide, I also like this slide too, and this diagram shows more in detail of the specialized medical teams that are involved in the treatment plan, determining your treatment plan based on the course of your disease, whether it's localized or advanced metastatic disease. For example, in the very top where it says localized, you can have your urological surgeon, our radiation oncologist, the med oncologist, the radiologist who would interpret your imaging. And in that setting, there are various treatment options that are available for you. That could include AS stands for active surveillance for our low-risk prostate cancer patients. Another treatment option is a removal of the prostate, or you could do radiation therapy coupled with hormonal therapy or focal therapy. And next, on the other part of this slide, shows the follow-up and monitoring and all the team providers that are involved and what modalities we use to monitor your disease. Again, this diagram encapsulates the level of collaboration that happens behind the scenes with our medical teams to deliver a tailored, personalized care plan. Next, we have tumor boards. And tumor boards are essential to our multidisciplinary care at Stanford. They include the surgeons, our radiation oncologists, the medical oncologists, pathologists, and radiologists. They all come together to discuss complex cases when treatment decisions are not straightforward and when clinical guidelines may not offer clear-cut answers. As I mentioned earlier, prostate cancer can be very complex, and so this collective of expertise is invaluable, lending insights, experiences, and perspectives through thorough evaluation of prior treatments, pathology, molecular testing, and imaging studies to determine what are the best treatment options that are most appropriate for that patient. Next is discussion on collaboration. Collaboration is a vital component to multidisciplinary care. It allows for innovation and care to come together. And here are some of the exciting things that are ongoing at Stanford to help improve patient care outcomes. We have multiple clinical trials in various disease settings. We know that clinical trials help drive progress, expand treatment options, and offer hope for improved outcomes. Next, we have molecular diagnostics, which can be a powerful tool in the management of prostate cancer. It can help provide our doctors in determining the most effective treatment strategy. This is what we call precision medicine, and it can help to reduce the likelihood of overtreatment and minimize unnecessary treatment side effects. Next, we have healthcare artificial intelligence, which has the potential to revolutionize the diagnosis, the treatment, and management of prostate cancer. By leveraging artificial intelligence, it can offer more personalized and effective treatment. Next, we have targeted nuclear medicine therapy that Divya spoke about. And they have made tremendous strides in prostate cancer recently, especially in the metastatic castrate-resistant setting. These therapies use radioactive substances, such as something called lutetium, to help to target and destroy cancer while sparing healthy tissue. And this helps to enhance treatment effectiveness, but also helps to reduce treatment side effects. Next, we know that this can help to decrease healthcare disparity to help providing tailored care and help to address social determinants of health, which allows for a more inclusive and equitable health care system. In conclusion, prostate cancer is a multifaceted disease that demands a multidisciplinary approach. By working together, we can enhance the overall well-being of patients in a comprehensive and holistic manner. And lastly, this collaborative approach extends beyond treating the disease. It's about caring for the whole person for improved outcomes and quality of life. Thank you.